open this hearing. Good afternoon, everyone. On behalf of the chairperson of the Committee on Health and Demography, this hearing is now called to order. I welcome everyone. This is a joint committee hearing with the Committee on Finance. Just for the record, the chairperson of the Committee on Health, Senator Bongo, who is also present, has asked for my assistance to hear some of these measures in the Committee on Health. And we started, is it last week or this week? Basta, we started with a set of hearings a few days ago. I'll update you because those hearings are also connected to these hearings. Let me acknowledge the presence of the three senators, Senator Go, Senator Marcos, and Senator Hontiveros. And let me tell you
Good afternoon, Madam Chair.
Hello, good afternoon. Let me explain the flow of these hearings today. So there are 9 bills categorized into 3 different topics. They are the bills on the National Security Act and related thereto. And then there are the bills on the Medical Reserve Corp. And then there are also the bills on the creation of a Center of Disease Control. So those are 3 separate topics, but they all fall under the umbrella of national health security. And that is why I decided to hear them all together today. We will not go into the details of each one today because it will take too much time to go through the details of each. But what I really want to accomplish today is to see the importance of having a national health security plan, to be prepared, and what are the integral components, infrastructure or systems that go into this. Based on the bills filed, it would also be the creation of a CDC and a Medical Reserve Corps. That's why these are the bills that we're hearing today. But before I proceed, I also want to emphasize that the hearing I had earlier, and it escapes my mind now if this was just Tuesday, 2 days ago, or last week, and my staff refreshed my memory. We had hearings on health infrastructure. This included basic health. It was last week, now I recall. It's basic health care and also the importance of investing in what was already started a few decades ago on the specialty healthcare systems. So I am aware that there were previous discussions because there was already a hearing held on the Medical Reserves Act. I am aware that there were some reservations on this bill, specifically stating that we should instead emphasize our basic healthcare systems. I'd like to put on record that I am all for that. I am all for strengthening the basic healthcare system. There is nothing in these bills that justify in any way and justify a neglect of a basic healthcare system. So I understand that given the limited resources, there would be a concern that every time we focus on something else, it will take away from these basic healthcare. And I understand that concern, and it is a very valid concern. But that is why my request to Secretary Galvez in particular, and of course DOH to be represented by Yusek Vergere, would be to tell us how our current systems work such that do our institutions coordinate like clockwork such that if there is a pandemic as we are experienced, ganun ba kadali mag-pull out ng staff, ng health personnel from one institution at ilipat sa kabila? Kasi from everything I've heard, that does not happen easily. And that is the concept of the medical reserves. Na madali kang mag-pull out, madali kang mag-deploy dun sa areas na kinakailangan yung health specialist mo. So without that, even if we strengthen the basic, it is not going to happen overnight na makakapag-pull out ka lang ng basta-basta. So that is the underlying principle behind the Medical Reserves Act, which I happen to be one of the authors, and therefore I have a little bit of a deeper understanding of that bill. So on that note, before I proceed, let me just check what else I want to say. Yes, I also want to emphasize that the reason this is very important to me is also because I currently chair the Senate Committee on Sustainable Development, Innovations, and Futures Thinking. And as you know, Sustainable Development Goal number 3 is good health. And futures thinking dictate that we plan. If we do not plan, we will not wake up one day and have a health system that is responsive to the possibilities of different health crises arising. We will not have it. It will not appear overnight. So it is very important that these systems and facilities are in place. Obviously, we'd like to take off from the lessons we've learned over the year under the leadership of Secretary Galvez. The IATF is somewhat set up similar to, well, the other way around. The National Health Security Act somehow reflects what they're doing in IATF, which is making use of the whole of government approach, whole of society approach. So the input of Secretary Galvez will be very important here. Futures thinking wise, I'd like to point out that we act as if this caught us by surprise. Of course, infectious disease doctors, epidemiologists will tell us that just like Bill Gates' talk in 2015, there was no surprise about it. The world was just unprepared for the outbreak. Well, in the same way, we were unprepared for Bill Gates' separation from Melinda, but that's another topic. Just to say that he has made these statements. Natawa ka, Amy. Yeah, because I've been following Bill Gates is a futures thinker, like a few, and so that is really a philosophy that I'd like to embed in our planning. Yeah, I can end here. I have more to say, but I'll say it as we go along. Let me acknowledge the authors of some of the bills. I'm not sure if Senator Riza would like to make a statement. She has a bill similar
Yes, please,
to
Madam
my
Chair.
bill. So please go ahead, Senator Riza. Would you like to say something?
Yes, please, Madam Chair, at salamat. Magandang hapon, Madam Chair, Sen Bongo, at yung iba pa naming mga colleagues dito, at syempre lahat ng mga resource persons natin. Madam Chair, maraming salamat sa paglalaan ng oras at pagbibigay ng pagkakataon na dinggin ang mga panukalang batas na nakahain sa ating komite, lalo na o pati na ang aking Senate Bill 1801 o Philippine Health Security and Emergency Act. Gayon din ang mga kaugnay na panukalang inakda naman ng ating mga butihing kasama, sina Senators Pia at Nancy. Madam Chair, the bill I'm proposing intends to strengthen the preparedness and capacity of the country to respond to public health events and emergencies. The bill is guided by the recommendations of the World Health Organization and the Department of Health with regards to our obligation under the international health regulations to develop our minimum core capacities to detect, assess, report, and respond to public health events and emergencies. The bill I'm proposing, Senate Bill 1801, hopes to contribute to this end as an enabling policy that would establish a national action plan for health security and emergency, create a high-level and health sector-led interagency body that will implement the action plan, and foster the institutional capacity of the health sector to lead in public health emergencies of various types, infectious diseases, biological, chemical, and/or, heaven forbid, nuclear. Madam Chair, one of the main lessons we've learned and that has been highlighted while we are responding to the COVID-19 pandemic is the importance of the health system's preparedness, particularly its planning process, resource generation and mobilization, leadership and governance, and collaborative networks engagement. COVID-19 has taught us that we must ensure that the frontline health system has the capacity, the demonstrated capacity to take on public health emergencies and events. And integral to its duty to care, the health system should be able to continue to provide for essential healthcare services even under the most challenging and difficult circumstances. As advocates of universal healthcare, I'm sure that we all share the same belief that strengthening our national, regional, and local capacities for public health emergency preparedness is a critical component of universal healthcare and will be a companion measure to the UHC law. Madam Chair, more than a year into the COVID-19 pandemic, while we still hope, pray, and act for the best outcome of our pandemic response, there is no other suitable time to work together to strengthen the health systems and ensure effective health security governance. Today's hearing is an important step towards health emergency preparedness and to overhaul our public health emergency management systems. At ang mga panukalang tulad ng Senate Bill 1801 hope to become a policy instrument to this end. I hope that our stakeholders who are with us today will agree with the need for this piece of legislation. Marami pong salamat, Madam Chair, at magandang hapon muli.
Thank you, Senator Riza. The other authors that are present so far are Senator Marcos and Senator Go. So can I give the floor first to Senator Go, who is the chair of the Committee on Health, and then after that, Senator Marcos, if you have anything to say also as an author of one of the bills. Senator Go, you have the floor.
Good afternoon. Good afternoon to everyone. I just want to give a short statement in support of the measures for discussion. First of all, I would like to thank Senator Pia Cayetano, Vice Chair of this committee, for graciously accepting to preside over this hearing as Chair of the Committee on Health. One of my priorities is to make our health system better prepared to respond to future health crisis. Kaya po, full support po ako sa mga bills for discussion today. I'm glad this is also one of the priorities of Senator Cayetano, who is also the chair of the Committee on Sustainable Development Goals, Innovation, and Futures Thinking. Certainly, we must learn from this experience and employ futures thinking so that we can address the gaps and weaknesses to transform our health system. The COVID-19 pandemic has exposed the need to capacitate and improve our government health facilities. Ngayong pandemya, problema natin ang kakulangan natin sa hospital beds, particularly ICU beds. Kinakailangan po natin magtayo ng temporary facilities and modular hospitals for COVID-19 cases. But aside from these facilities, equally important is the service of our healthcare workers. Gusto kong pasalamatan ang ating mga healthcare workers at mga volunteers sa serbisyo ninyo sa bayan sa panahon ng COVID-19. Walang katumbas ang sakripisyo ninyo para malampasan natin ang pandemyang ito. The entire nation owes you a debt of gratitude and cannot be repaid. But the reality is our health personnel are strained by the surge of COVID-19 cases, which hinders our capacity to combat the disease immediately and effectively. As hospitals in the NCR Plus are overburdened, its medical frontliners are exhausted because of the number of patients. Some health workers in the Visayas express willingness to be deployed to NCR Plus areas. I am very thankful to them. They're one of the reasons for making us believe that the spirit of Bayanihan continues to live within the hearts of Filipinos. As we try to assess the situation, we see the need for a medical reserve corps which is why I filed Senate Bill 14 Senate Bill 1451. Ito po yung Medical Reserve Corps. Even the President in his recent State of the Nation address has acknowledged the need for this measure. We need a Medical Reserve Corps that may be called upon and mobilized to assist the national government and the local government units in their functions related to addressing the medical needs of the public in times of national emergencies. Those who are deployed should be properly compensated. The establishment of the Medical Reserve Corps will uphold the role of health workers in nation building and promote in them patriotism and nationalism. The global outbreak of the coronavirus disease sparked the need to have a comprehensive approach and multidisciplinary preparedness for the emergence and re-emergence of pandemic and epidemic diseases. Dealing with the diseases promptly and appropriately requires a reorganization and strengthen of the country's health units committed to prevent and control communicable diseases. It is for this reason that I filed the Senate Bill 2158, which seeks to establish a Center for Disease Control and Prevention or CDC. It shall be the principal agency tasked with developing and implementing communicable disease control and prevention initiatives. It shall be responsible for controlling the spread of infectious diseases. In other countries, centers for disease control have been instrumental in this pandemic. As experts in the field of infectious diseases, they're at the forefront of the health battle against COVID-19. It is high time for us to strengthen our health units and have our own CDC. President Duterte also acknowledges this and has urged Congress to pass this important measure. Again, let me reiterate, this is a learning experience for all of us, but then as we move forward, we need better foresight to successfully reassess what institutional practices we need to change. Institutions we need to further strengthen and make long-lasting plans not only for our recovery, but also for our sustainable future. Bigyan po natin ang ating mga kababayan ng bagong pag-asa at mas maayos na kinabukasan. Meron lang po akong idadagdag. I welcome the expected arrival of isisingit ko na lang po to. I welcome the expected arrival of additional doses of vaccines against COVID-19. This means that more people, particularly our frontliners and vulnerable sectors, will be given the necessary protection. Bukas po ay inaasahan nating darating na ang 1.5 million doses ng Sinovac. Pinaghahandaan na rin ang posibleng pagdating ng 2 milyong doses ng bakunang AstraZeneca mula sa COVAX facility ngayong darating na Sabado ng hapon. Ayon kay Vaccine SAR Secretary Galvez, patuloy ang pagdating ng mga bakunang inaasahan natin sa mga susunod na linggo at buwan. Malaking tulong lalo na ang AstraZeneca dahil marami sa ating mga medical frontliners, senior citizens at yung merong comorbidities ang nabigyan na po ng first dose nito at naghihintay na lang maturukan ng kanilang second dose. Tuloy-tuloy ang rollout ng ating COVID-19 vaccination program ayon sa ating priority list. Pakiusap ko lang po, sumunod tayo sa priority list, walang magpapa-importante, walang magpapa-VIP, dahil lahat naman tayo ay nangangailangang mabakunahan. Kung madadagdagan natin ang ating daily vaccination rate mula sa kasalukuyang 133,000 daily rate, mas maraming mga Pilipino ang mababakunahan at mas mabilis nating ma-attain ang herd immunity sa community. At bilang mensahe ko naman sa ating mga kababayan, huwag ho kayong matakot sa bakuna. Matakot ho kayo sa COVID-19. Magtiwala tayo sa bakuna na ang bakuna lamang ang tanging susi o solusyon para makabalik tayo unti-unti sa ating normal na pamumuhay. Huwag tayong maging kampante. Importante po dito, disiplina po. Disiplina sa bawat isa. Ulitin ko, magtulungan tayo at magmalasakit po tayo sa ating kapwa Pilipino. Maraming salamat po.
Thank you, Senator Bongo. Senator Marcos, as one of the authors, would you like to make an opening statement?
Yes, thank you very much. It's not a statement, it's just a few notes. Thank you very much, Madam Chair. Firstly, as the author of Senate Bill 1592, I also invoke the institution of a Medical Reserve Corps, and with the addition therein of a database for the medical workers in each LGU. That being critical in the establishment of said Reserve Corps, I think this perhaps can be embedded already with the SSS and other listings that we have, including the national ID. We have already encountered the many problems of the distribution of ayuda, AICs, food packs, and other help extended by the government to our marginal and unemployed sectors. I think this database would be critical, and the PRC and the TRED would clearly have an important role to play. But having mentioned the LGU as part of the effort to impose or establish this database, I also remind everyone of the Mandanas ruling that will dissipate perhaps the resources of our health sector and provide them instead to the LGU. So it's incumbent upon us to enlist the LGU support. The other issue is, of course, the importance of our addressing the many complaints, very justified complaints of our health workers. And it's important that we set forth the qualifications for the Medical Reserve Corps, but even more urgent is incentivizing them. As we know, incentivizing need not only be monetary, although it is lawful, but should also include their safety and protection with the adequate provision of PPEs, shuttle buses, and other requisites. As a matter merely of housekeeping, I would like to inquire from the chairwoman where we are. We all know that this effort has reached third and final reading in the House of Representatives. And we had a first hearing on the medical reserve on September 13 last year. So I hope that with the vice chairwoman's initiative, we can push forward with this. And finally, besides the salacious interest that many of us have in the Bill and Melinda Gates divorce, it's a matter of grave concern for all those interested in health, as they are, after all, the second largest donor to the WHO after the United States. And further, the Gates Foundation has funded malaria, tuberculosis, and many other initiatives. In my case, I am particularly a fan of the pivotal ventures of Melinda that funds single moms. So thank you very much.
Yes, well, they did say that they will continue to co-chair the foundation. So, but yeah, we can talk separately about our concern for their love life, but in terms of the forward movement of the foundation. She's actually a friend. I've met her, so I don't say this in jest in any way. I'm a romantic at heart, so I do feel bad about all this. Anyway, that's just on the lighter side. Nakakaintindihan kami ni Amy, natatawa kami pareho, pero yun. Okay, I'm not aware that there are other authors of the measure that are present with us today. So I won't read all the bills. It is in the agenda. You know what they are. Just to say that a number of our other colleagues are also co-authors, Senator Binay, Senator Poe, Senator Pacquiao, Senator Gordon, and I think I didn't miss out on anyone. So those bills are all there, and I think we can officially start with our resource person, given the background of what we've given, you've heard so far. So our first speaker will be Yusek Vergere, representing DOH. She's from the Public Health Service team. Yusek, you have the floor.
Yes, thank you very much, Madam Chair. Good afternoon to all of the honorable senators and to all of my fellow public officials. Magandang hapon po rin kay Secretary Galvez and Secretary Vince Dizon. So for today, we will be presenting these three topics or three bills, mainly the Philippine Center for Disease Control, the National Health Security Bill, and the Medical Reserve Corps Bill. Next slide, please. So in total, there had been bills on the creation for the Centers for Disease Control. We have bills on the Medical Reserve Corps, and we have bills on the National Health Security Bill. The
Sorry,
Department of...
Yusek,
Yes,
sorry, let
ma'am.
me just interrupt you. I forgot to give my my rules for the committee hearing. My request to my colleagues is to allow the key speakers, ano lang naman yan, DOH and IATF to complete their presentation before we ask questions. But obviously, if there is something in the slide that you want clarity on, since there are just a few of us, please feel free to just ask for clarification. Pero wag na muna yung litanya ng mga tanong natin. Later on na yan after the presentation. Okay. Sorry, please proceed, Yusek.
Thank you, Madam Chair. So as what we have discussed, we are going to present these three bills alongside with each other as we feel that and we thought that these are all related. Next slide, please. So we have identified gaps and potentials for the legislative protocols. We have classified those gaps as to national, regional, and local levels. Can we have the next slide, please? So institutional expertise in infectious diseases, public health, data analytics, and forecasting. By this, we mean having practitioners within the institution rather than always having to convene them. So currently, what we have right now in this public health emergency would be that we only ask our experts from different institutions to help DOH in guiding us for decisions and for policy making. So in this recommended or proposed bill, the institutional expertise shall be within the Philippine Center for Disease Prevention and Control. So the CDC proposal may be able to address this if the future structure will adopt a scientific career track system similar to that of the National Institutes for Health and the Philippine Institute for Development Studies, where their experts are not on full-time capacity, but they can still practice their science, they can still do researchers, and can still do their clinical work in hospitals. The second would be a proactive international surveillance and strong border control. So the CDC proposal may be able to address this by making the delineation that the Center for Disease Prevention and Control will take on surveillance and policy, whereas the Bureau of Quarantine will act as the implementing arm of the CDC at the ports and our borders. The third, multi-sectoral ownership of international health regulation obligations during peacetime or when there is no pandemic, and again, a stronger multi-sectoral ownership during a pandemic during war times. So the National Health Security Proposal may be able to address this by creating the IATF-like structure with 8 core members for continued IHR investments and monitoring. And the second, to elevate to the President plus the Cabinet in case there is a public health emergency. The next would be coordinated response infrastructure, which is what we had to build overnight with the creation of the National Task Force and other bodies for this COVID-19 pandemic. The National Health Security Proposal may be able to address this by designating the National Disaster Risk Reduction and Management Council as the default national task force or the national task force during public health emergencies. And before the pandemic started or before we had this public health emergency, the NDRRMC was the default structure in government whenever we are having these disasters that we need to respond to. Next slide, please. For functional data infrastructure for disease surveillance, the CDC proposal may only partially address this since in the operations and this is contingent on the submissions by our disease reporting units, which would be our hospitals and the local epidemiology and surveillance units. So meaning the CDC is just the user of the information. We receive the information coming from our disease reporting units, but we need to strengthen this data infrastructure among our disease reporting units, and that would be our hospitals and local governments. The next would be a dedicated national laboratory that is more focused in terms of functions. The CDC proposal may be able to address this by strengthening the Research Institute for Tropical Medicine mandate as reference versus service laboratory or versus service provider. We all know right now that the RITM still has functions for hospital and for laboratory services. But with this proposed CDC, we may be able to have a more focused mandate for the RITM to do the functions and the mandates of being the national reference laboratory of the country. Next would be sufficient and trained epidemiological surveillance units at the regional level. The CDC proposal may be able to address this if the proposal will include hiring of cadres for regional offices. Also, we propose that there is renationalization of our epidemiology and surveillance units, and by virtue of this bill, the people in the local and regional will be staffed under the Philippine CDC. Meaning, these offices, which will be renationalized, will do the operations and enforcement for the Philippine CDC, whereas all the policies and standards and other components of the Philippine CDC are solely on the national level. Next would be the availability of reference laboratories in 17 regions. The CDC proposal may be able to address this if the proposal will include investments for such reference laboratories like mini RITMs in the different regions of the country. Next slide, please. So next, at the local level, sufficient and trained health human resources in local governments performing public health management, epidemiology functions, risk communication, and patient navigation. CDC proposal may be able to address this if we will include hiring of cadres for local government units. Realistically, this is just public health management and epidemiology functions, but issues on verticalization and governance needs to be threshed out since epidemiology functions will be optimal if vertically integrated. And just for the information of our honorable senators, we only have less than 10 functional epidemiology and surveillance units among our different local government units. Next would be at the local and private facilities, sufficient healthcare cadre. The MRC or the Medical Reserve Corps proposal may be able to address this by providing a mandate to require all healthcare professionals to come serve the government and the country during public health emergencies. It is not just that we get and reassign our healthcare workers from our facilities and our community health facilities and serve the government at the national level, but maybe we can also track from the Philippine Regulatory Commission all those healthcare professionals with licenses, and we can mandate them to serve the government during times of public health emergencies. The next would be at the local level, but there is varying implementation of national policies, and the CDC proposal may be able to address this if it will include clause obligating local governments to abide by national policies during these public health emergencies. This is very evident. Currently, we are seeing different local government units having different interpretations of national policies, or it's not really interpretation, but they would like to implement on their own. And this is not acceptable, especially that we are having a public health emergency. Next slide, please. So the International Health Regulation is a legally binding international instrument for global health security to prevent the international spread of disease. It contains the national and international commitment for shared responsibilities and collective defense against disease spread. The IHR implementation contributes to the international health security. In 2017, the Philippines voluntarily requested a joint external evaluation as part of our commitment to the monitoring and evaluation of core capacities for international health regulation. A series of consultations were conducted with relevant agencies between 2017 and 2018. The overarching recommendations were as follows. enhance the high-level political commitment, engagement of all relevant sectors, and accountability at all levels to advance the implementation of the international health regulation. There is a need for a high-level IHR task force, a permanent body with decision-making power and budget integrating all relevant departments, that is from DOH to DILG and the other concerned agencies. There is a need for an IHR working group, permanent entity with decision-making power and budget within DOH to smoothen collaboration between the IHR, the national focal point, and other key bureaus and services. So this is really for DOH. The second is active involvement of all stakeholders in overarching national action plan for health security, which is costed, maps risk-based priorities within and across sectors, and guides investment and the harmonized implementation. The third is the need to overhaul the health system to enforce adherence to guidelines issued by regulatory offices like DOH at the national and regional levels to ensure proper implementation at the local government levels. The fourth would be to need for separate supply chain structure for procurement of essential supplies, including vaccines and PPEs, to avoid delays due to complexities of public tenders through DBM and the Department of Finance. And the last is we should strengthen our monitoring and evaluation practices and foster a culture of continuous improvement by feeding the lessons from after-action reviews into ongoing refinements of the system. Next slide, please. This bill, the National Health Security Act, fully supported by DOH, next slide, please, will address the WHO Joint External Evaluation Team recommendations to enhance high-level political commitment, engagement of all relevant sectors, and accountability at all levels to advance implementation of international health regulations. This need for high-level IHR task force and council, and the need for the IHR working groups. Next slide, please. So regarding the need for a proposed framework for international health regulations, we got this from the joint external evaluation of the IHR. So this is set already. There are 9 technical areas assessing capacities to prevent, to detect, to respond, and other IHR-related hazards and POEs. And there are 49 indicators for this 19 technical areas. So we do not want to reinvent the wheel. We propose that we just adopt this framework. Next slide, please. So the official IHR Joint External Mission where we were assessed was conducted last September 9 to 14 of 2019. And this slide, we just showed the members of this audit committee, the IHR JEE mission. Next slide, please. So our scores from that evaluation are presented on this slide. However, as the mission had concluded in the latter part of 2019, we weren't able to do anything as the pandemic had struck months after the mission. So we were not able to get any scores of 4 or 5 in this evaluation. Our highest score item was points of entry. And moving forward, this assessment should be the base at which we should work on and move forward so that we can be able to achieve all of these targeted goals. Next slide, please. By institutionalizing the Philippine CDC in the DOH, OSEC, we will improve our capacity to prepare for and respond to public health emergencies to protect lives and allow development to proceed even the worst of times. Establishing the Philippine CDC will ensure that the Philippine healthcare system is well prepared to forecast, to prevent, to monitor, and to control emerging and re-emerging diseases and threats, both of the national and international concerns. Furthermore, its creation will ensure operational readiness for disease surveillance, strengthening epidemiologic reporting systems, increasing manpower and technical capacity, and further strengthening laboratory capacity from the national down to the local levels. Next slide. So the key features of the Philippine CDC are the coverage of prevention and control of infectious and non-communicable diseases, investments on ICT to ensure up-to-date field data for responsive decision-making, conversion of the RITM into a premier facility for clinical laboratory, epidemiology and implementation research and training on infectious diseases and tropical diseases, and adoption of the scientific career system for qualified employees of CDC, allowing technical experts to continue the clinical and professional practice, particularly to pursue their research interest or receive grants and honoraria as long as within the mandate of the CDC and in consultation with the Civil Service Commission. Next slide, please. The Philippine CDC was conceptualized with the idea to improve local engagements in preparedness and response to public health emergency. So specifically, the Philippine CDC is meant to exercise automatic command and control over local governments during national or local public health emergencies, develop performance-based incentives to private facilities with internal epidemiology and surveillance units, and to ensure establishment of ESUs in every province or city wide health system in line with the UHC Act and Mandatory Reporting of Notifiable Diseases Act. Next slide. So under Section 7 of the draft substitute bill, the following DOH units, their divisions or functions, are transferred to the CDC. And this includes first, the Epidemiology Bureau of the DOH, the RITM, select functions of the International Health Surveillance Division of the Bureau of Quarantine, and technical and standard setting functions of the Disease Prevention and Control Bureau of DOH. So for DPCB, the program management function will still be left with the DOH Central Office. Next slide, please. So the proposed structure of the Philippine CDC is as follows. Lodged under the DOH OSEC, the CDC will have 6 offices, 2 of which are directly under the Director General. They are the Communications Office, which shall ensure dissemination of relevant scientific and technical information in a timely manner with partner agencies and international and local organizations on matters pertaining to CDC mandate, and the Admin and Finance Office. There will be 2 Deputy Director Generals, which shall directly supervise 2 offices each, and these would be the Centers for Epidemiology and Public Health Surveillance, Center for Reference Laboratories, Center for Preparedness and Response Planning, and Center for Health Evidence. So as mentioned earlier, the main staffing pattern of the centers will be based on the scientific career system resembling that of the UPNIH and the Philippine Institute for Development Studies. Next slide, please. So the next topic would be the Medical Reserve Corps. Madam Chair, if you will allow me, I will call on our OIC Director for our Health Emergency and Management Bureau, Director Ronnie Law, to give this presentation, Madam Chair.
Yes, please proceed.
Thank you, Madam Chair.
Thank you, Madam Chair. So good afternoon, honorable senators, DOH officials, and other officials and partners from our other government agencies. So I was tasked to present some background there of the Medical Reserve Corps, or the MRC, and our DOH proposal for your consideration. Indeed, the MRC is an important component of our health security in the country. First, we welcome this move to develop a more responsive, formalized, and comprehensive system for mobilizing our health human resources during times of calamities, especially public health emergencies, which is the case now for COVID-19. The MRC, in fact, is a US model. So this came in the wake of the 9/11 terrorist attacks in the US in 2001, when the American Freedom Corps was established in the White House. So this is all to instill a culture of service and volunteerism in the US after that unfortunate incident. So this Freedom Corps has several components, namely there's the Citizen Corps, the Peace Corps, and this also includes the Medical Reserve Corps. So when this was put up, the model was a departure from the usual mutual aid agreements that are happening from state to state in the US. And it's also a little different from the volunteerism as popularized by the Red Cross. So this MRC program is sponsored by the federal government and lodged under the ASPR, or the office called the Assistant Secretary for Preparedness of Response under the Department of Health and Human Services. So by design, it is a national network of community volunteers. So we have to take note volunteers. So the whole thing runs on the concept of volunteerism. By composition, it is made up of medical and public health professionals. And also, we have to take note, they also have non-medical members. So they are just provided with the needed trainings to make them able to do the job. So basically, they're called upon to strengthen response capabilities to natural disasters, including disease outbreaks. So in fact, the Medical Reserve Corps was utilized a lot in the Hurricane Katrina response in the US. So for these outbreaks happening in the different states, these MRC teams would also be deployed. So during peacetime, so to speak, they're also mobilized to perform different public health functions such as vaccinations, prophylaxis, and even health promotion campaigns. So aside from their response functions, they are also a critical component of community resilience. So the concept of operations revolves around the pre-identification of these volunteers, credentialing them, which is being done by the different states. So what they do is they match the qualified ones with the actual needs in the community. And training here is the main incentive. Again, they are not compensated, but rather given free trainings and their actual activation if and when there's a trigger. So I just mentioned this because it's worth looking into this background if we are to propose the appropriate MRC model that we need in the Philippines. So next slide. For our proposal for consideration of this body regarding the Medical Reserve Corps, uh, first, if we can kindly consider the leadership of the Armed Forces of the Philippines and our Department of National Defense because of its mandate of enlisting, training, and mobilizing citizen armed forces. This is by virtue of Republic Act 7707, our Citizens Armed Forces Reservists Act, and Republic Act 9163, or our National Service Training Program law, and its capabilities in carrying out expeditious response to war, lawless violence, and early calamity, including public health emergencies. Aside from this clear mandate, of course, the military structure, might, and speed are critical success factors of this MRC. So we hope this merits consideration. So in light of COVID-19, as mentioned a while ago by no less than Senator Cayetano, the health sector is faced with many challenges in pulling out people to be deployed to do response from place to place. So traditionally, medical frontliners would usually be fixed to a certain hospital or facility, to a certain locality, preventing them from being deployed to other areas. So we have to look into a lot of these aspects. So although we have health human resources, there usually won't be enough to manage the challenges and demands of public health emergencies. And this is more complicated, of course, because of our devolved setup in the health sector. So if the armed forces of the Philippines will be leading, the DOH, the Department of Health, can provide the needed technical assistance and training and continue to perform its functions on incident management, coordination, and resource mobilization and augmentation, being lead of the health cluster. And this is also in line with our mandate in the UHC law on the establishment of the National Health Workforce Support System. Since we have a system for this, we can assure this. So with close coordination with the AFP, as evident in our National Disaster Response Structure, which was mentioned a while ago also, the DOH can provide significant contributions to the Medical Reserve Corps. So next slide. If the Department of Health will lead, though, we think the following are the imperatives. We should be the points of our discussion. First, may we be clarified if the bill talks about the recruitment for a medical reservist. So is this for voluntary, mandatory, or a paramilitary one? So this will have a bearing on the number of people we can enlist, train, and actually deploy. So of course, if it's voluntary, as is the essence of the MRC model in the United States, we might not have enough takers. So especially if there will be no compensation. Mandatory will help us with the numbers, but this can elicit some reactions. But this forms part of the recommendation for us mandate, no, for us to really mandate health workers to serve their country if and when it is needed. And we believe the mandatory thing is also part of the NSTP law. So if paramilitary, meaning to say having the semblance of a military structure, this is good, but this has implications on the organizational structure to be created. Next, we also want to clarify if the scope of the bill is limited only to medical graduates, health-related field, or shall we include non-health professionals? So this will determine the scope of our operations and capacity building, and of course, this will determine the range of services that we will be able to provide. Of course, it goes without saying that we need to provide good working conditions, uh, providing compensation and incentive packages, whether monetary and non-monetary. And we also need to clarify some legal liabilities to be able to, of course, not only entice them, but we also have to be able to protect and promote the welfare of our health human resources. Lastly, the current capabilities of the Health Emergency Management Bureau, if and when DOH will have to take on this important role, we have to be bolstered in terms of our capacities to manage the Medical Reserve Corps. This is in terms of human resources, funding, and other requirements. This concludes the part of my presentation, Madam Chair. Thank you po. Over.
Thank you very much. It was very informative. Yeah, we will go into a discussion na lang later, as I said, no? But thank you for that. So, are you done? Are you set? Do we go back to you, or do you have? Does that end the H presentation?
Madam Chair, that ends our presentation, ma'am. Thank you po.
Okay. So, as discussed, I'd like to give the floor now to IATF. And then after that, we can have dialogue. But just so you know also, aside from DOH and IATF, we do have WHO, which I feel is also a good perspective to hear. So we can listen to best practices, international practices. And then we do have health organizations and other groups who we will just call on a needed basis to give reactions or comments to the presentations later on or to questions of the senator. So, Secretary Charlie, are you ready?
Yes, ma'am.
Sir, please
okay.
go ahead.
Yes, ma'am. Madam Chair, Senator Pia Cayetano, Senator Bongo, all the members of the Committee on Health and also our members of the DOH. Magandang hapon po. For this afternoon, I will make certain presentations on the background on the holistic view of our healthcare structure. As you can see, we have a 109 million people population, and considering that during this pandemic, we have seen that the 9.5 senior citizens are most vulnerable. At the same time, the A1, the A2, the A3 that we have prioritized for the vaccination consist and comprise to 25 million populations that we have. But you can see also that in some areas, some demographics, these different demographics, they are also vulnerable to other fatal diseases that we also considered during the pandemic. As we can see on the Filipinos lifestyle, we work longer hours and eat more processed food, and we are exposed to pollution and natural disaster. Thereby, we have a higher risk of diseases, and at the same time, it will increase demand for our healthcare system. Then on the prevalence of communicable diseases and non-communicable diseases per 100 populations data in 2016, the Philippines has the highest prevalence rate of communicable diseases like TB, HIV, dengue, hepatitis, and among its Asia's neighbors. So we are also second on the non-communicable diseases, like for example, hypertension, diabetes, and cancer. And we are the highest incidence of tuberculosis in Asia and third in the world for having 1 million active cases in 2018 and many Filipinos die in TB daily, 70 Filipinos. We have also some reports from the US experts that cited in 2018 that 1 out of 3 Filipinos die before the age of 70 due to non-communicable diseases, calling this a crisis, a pepper storm that threatens and undermines all the progress that made recently years and the dreams of the Filipino families in the country. We have top 4 causes of death, which basically also suffer during this pandemic, considering most of them are afraid to go to the hospitals. These are the heart disease, the cancer, chronic, and diabetes. Right now, yesterday, we have opened up the dialysis center in NKTI, and we have seen the extreme pain of those families suffering from both COVID and also diabetes. Next. These are the top 100 leading causes of death in the Philippines, as shown. Next slide. As you can see on the different laws that we have enacted. In 1995, the National Health Insurance Act was created to provide the Philippine Health Insurance Corporation, and also in 2010, we actively pursued for universal healthcare. In 2013, the National Health Insurance Program was expanded for the contribution beyond formal employment to include underprivileged, the sick and elderly, the PWDs, women and children. In 2019, we have a landmark universal healthcare system wherein we signed the universal healthcare law being espoused by both the Congress and Senate. These are landmark indeed, considering that it provided a lot of benefits to our people. But considering the pandemic that we have, we support really for the National Health Security Act, considering that we have seen the vulnerability of the Filipino people when we have this kind of magnitude of pandemic. So we support the Senate for this enactment of the national healthcare system that will also exponentially increase our implementation of the universal healthcare system, because without the National Healthcare Security Bill or Security Act, we will be having a hard time of implementing and accelerate the implementation of the universal healthcare system. The Universal Healthcare Law guarantees equitable access to quality and affordable healthcare service for all Filipinos. It will automatically enroll Filipino citizens in the National Healthcare Insurance Program and expanded the PhilHealth coverage to include free medical consultation in primary clinics and laboratory tests. But the Universal Healthcare Law does not guarantee the quality and the affordability of the healthcare services that we will be getting. We can only have that if we have self-sufficiency. At the same time, we have the National Health Security Act. And these are the other significant reforms under the University Healthcare Law. We have designated PhilHealth as the national purchaser for health goods and services, and then the improvement of health facilities, especially in underserved areas, responding to the gap in health workers throughout the country. So we will discuss this in a few slides that we will be having. Then the strategic engagement on the private sector. During this pandemic, we have seen the significance of the private and public partnership. And through the National Security Act, National Health Security Act, we can enhance further this engagement. And then lastly, the creating and expanding the new functions in the Department of Health to improve the delivery of health services. And that's also the creation of the CDC. And then this is the structure of our healthcare providers. At the LG level, we have a full autonomy and responsibility for managing and implementing their own health programs and services because of the devolution of the local government code. The DOH already provide the technical support. This provides dysfunctional gaps in the unity of command and unity of effort, meaning the unity of command was lost because DOH can only command until at the regional level. And also during the complete devolution of the healthcare system, the maintenance of level 3 hospitals have been degraded. I have seen this, especially in Jansan, that a city of 600,000 people, their hospital is only an infirmary. It was reduced to an infirmary. How can we react during the COVID-19 crisis if we have only an infirmary reacting to the 600 requirements, 600 requirements of 600 people. The provincial government are given the responsibility of managing and opening primary and secondary level hospital services through the district and provincial hospitals. The provincial government are mandated to provide primary health care, including preventive and promotive health services and other public programs through rural health units, while the highly urbanized independent cities are given the responsibility of both hospital services and primary care service. With the devolution of our health services, the integration and the renationalization of our command and control and strategic direction should be further enhanced. Next, on the shortage of medical professionals. As you can see, we have fewer colleges and graduates finished for medical degrees. Since you can see in 2007 to 2010, we have enough graduates from medical courses. But right now, in 2018, we have reduced the capacity of producing more college graduates for medical degrees. Next, we have a brain drain. The Philippines exported more nurses than it produced from 2015. The data shows that starting in 2015 and 2016, we are exporting more than we are producing nurses. And this is a reality right now that our healthcare system during the pandemic and COVID-19, most of the hospital closed half of its capacity because they have lack of nurses. We have seen this in Cebu, wherein 600 capacity hospital, they were only operating to 300 beds because they lack nurses and staff. And I think it's also true with Metro Manila. Most of our hospitals, they close wards because they don't have nurse and nursing staff. In the same way that during COVID-19, it requires, it doubles or even triple the requirement in terms of nurses and doctors, considering that they will be in duty in 24 hours. At the same time, they will be quarantined, forced quarantine for 14 days. Next slide.
Secretary, I'd just
Yes,
like
please.
to add some data relevant sa presentation nyo now. I was given a presentation before that showed that by 2044, so that's more than 20 years from now, that's the only time we would have enough doctors in the country. But we
Yes,
will
yes.
never have enough nurses and midwives at the rate we're going. So just to really put that in, because what I failed to point out in my opening statement is we also discussed in my last hearing the importance of our health human resource. So
Yes.
I'm sure that is something that is part of your concerns in looking at the health security. So I just wanted to add that. Thank you.
Yes, ma'am. I would like also to ask the honorable chair and also the honorable senators that we should also include in our plan, in our National Health Security Act, our preparation for the long haul for this COVID. During our meeting with the private sector and also with the experts, they said that this pandemic will be a long haul. So it will not end in 2021, but also it might conclude on 2021 to 2023. So for 2021, our strategy is containment strategy, wherein we will enable our hospitals and our medical systems to respond through a very concerted action and a strong, what we call response strategy, wherein we strengthen the PDIPR strategy. And also in building resilience, we need to strengthen our barangay COVID response and also to build more ICUs and hospital beds for moderate and severe cases. And we have also to develop and mobilize health human resources, considering that it will be a long drawn battle. Our doctors and nurses will be fighting for more or less 2 to 3 years in the backzone. And then we have to provide other protections and vaccines. So meaning our vaccination will be a multi-year program wherein we will develop a lot of regimen in vaccination. We can also enhance the plan of vaccinations by coordinating with the different manufacturers and the capabilities to have a Philippines in our country. And then also we have to include in our plan how to build our economic with resilience, considering that in this pandemic, the most affected are our economic sector. And then in 2022, we will be working on the eliminations of the disease by gaining more access on the platform of vaccines and boosters that can prevent infection and mutation. Considering that there are a lot of mutations, also the manufacturers are also inventing on some technology and platforms, new platforms, so that they can prevent mutations and also prevent the incurring of the mutations. So, and also the elimination of the disease and also the social healing from the stigma of COVID-19. The bill should include also on how we will manage the social distress and the mental distress from this pandemic. The stigma is so huge that we cannot even imagine that after this pandemic, we will have a lot of mental cases. And then also for the humans, what we call it the National Health Security Act, we need to prepare for the next pandemic and disaster of great magnitude. And we can only achieve this by having health security. And we have to modernize our healthcare system. And we have also to renationalize and integrate the Philippine healthcare system that had been disintegrated during the full devolution of our healthcare system during the enactment of the local government code. Then these are the possible inclusion of the proposed health security bill. One is providing a national health security policy and a strategy for health sufficiency and health security. This would be the National Health Security Strategy and Preparedness to Disaster of Great Magnitude and during this pandemic. Like for example, in the military, we cannot do the modernization and the modernization of the armed forces without having the national military strategy. In this case, we can only integrate and will have a strategic focus if we will have the national health security policy or strategy. And then we have to have a provision of national health security and modernization plan. It should include the human resource development plan. How we will have the management and professionalization of our healthcare workers through an active and also a reserve component, wherein we will manage both of them together, so that the medical reserve corps will be put into place during the time of disaster. Second is we develop a campus and facility development at the national and regional level. Meaning, in India, when we went there, they term a certain facility as campus, so that it will be a thriving community, to including that they can have the self-sufficiency in really administering the pandemic. We have seen India, though they are having their health sufficiency. If we will be having that kind of situation right now, we will be suffering as great as much as India. And then also the modernization and acquisition of modern equipment and technology. And also we have to achieve vaccine security and research and development. And we have to develop also our organizational development, command and control, communication, and computerization and information, where we are weakest in this area. Number three is the civic location. We have to strategize on the location of the DOH National Hospital and also the private level 3 hospitals. For example, during the pandemic, we have seen that most of our special hospitals are concentrated in Quezon City. And there are many cities in Metro Manila that doesn't have specialized hospitals. And we also saw that Region 4, there is a vacuum in Region 4, wherein they can be easily overwhelmed. The regional is only located in Batangas, which is we believe it's off-center, considering that the main hub nearest the city is in Laguna, Cavite, Rizal, and also in Batangas. And also we have to have the regionalization of healthcare providers' capacities and central hubs. Like for example, we should develop a St. Luke's capacity or medical city capacity or Cardinal Santos capacity in the areas of Cagayan de Oro, in the area of Davao, and also in Cebu, and other areas that can be easily affected by the pandemic. And then also the establishment of the Reserve Corps in the form of in the ranks of the APPNP PCG and also with the Bureau of Fire. We can do this by automatically recruiting 5 to 10% of medical related recruits for the medical fields. In the organization of the armed forces, for a 9-month team, one of the primary organization of the 9-month team is a medical aid man. So meaning for the armed forces, it is required for them to recruit more or less 10% of their people should be medically related field, wherein they will recruit more or less 5 to 10% nurses or doctors, so that they can have some sort of organizational harmony, wherein they need for every 9-month team they will have a medic. And then also we have to establish medical centers and campuses in strategic regions. And also the establishment, we recommend that the CDC should be a center for disease prevention and control. So that's all.
Sec, just to clarify, what do you mean by medical campus? Ano yung campus?
Medical campus is like a medical center. If you have a medical center, you have a medical campus there, meaning the family
Related services.
Medical campus. Like for example, ma'am, the perfect sample is we have to produce more Southern Philippines Medical Center. It's a campus in a sense that all specialties are all there. It is a campus of all medical fields.
Okay. Sige. Sir, that you're done, no? That's the end of your presentation. Let me just make a quick response to it before we move on. Regarding yung tanong ko on campus and your mentioning of Southern Medical, I'm familiar with it. I've been visiting that for more than 15 years. In the hearing we had last week, no, which we should have invited you in, but just to let you know, we touched on that exactly. We touched on the need for health investments in health infrastructure that would basically tie in the basic healthcare system with specialty hospitals all over the country. So we have that in place. I can just perhaps ask somebody to send you that presentation by one of the, I think DOH was the one who made it, so that you can see that and we can also get your comments on it. So just to note, just so you know that the committee has been working on that also. And then the second point I want to emphasize, because I do not want to lose the opportunity to get your insights also on it, and perhaps you can also contribute in moving this forward. You included the importance of health human resource in your presentation, and I made a quick comment earlier. But when we also talked about this in the last hearing, I mentioned that one of the first issues that I tackled around 2004 or 2005 when I chaired the Committee on Health was precisely the human health resource, because this was at a time, yung demand kasi for our nurses is cyclical in most countries, no? Tataas, lahat ng nurse, daming nag-aaral ng nursing, tapos kala nila makapunta sila sa US, by the time they graduate, nag-freeze hire. So pag ganun-ganun yon. So a lot of them for a while were jobless, hindi naman inabsorb dito sa Pilipinas. But the point I want to make is this. During that time, at one point, the Secretary of Health was Secretary Galveston, and that was his advocacy. He was sharing with us best practices in other countries, wherein the country that was in need, so the demand side, in need of our health resource, would actually be negotiating with other countries that also had a supply, and they would come up with an agreement wherein, for example, the country in need of the supply would provide for the would actually pay for infrastructure in nursing colleges, would basically pay for the education of those nurses, and then there is a commitment that X number of graduates would be given, and this is bilateral already, so that maganda yung flow. Kasi ang nangyayari, number one, we cannot prevent our citizens from traveling wherever they want to go. We know that, no? We can appeal to them, we can request, but until we can compensate them in the way that they get compensated abroad, that economic need cannot be fulfilled. And then for the young ones, it might not even be economic. It just may be a desire to spread their wings and visit another country, di ba? So my point is, we might as well take advantage of that demand and come up with a win-win scenario. And no one has taken the lead on this, Secretary Galvez. Baka pwedeng i-include mo na rin yan because I like your presentation that it is a admission that we need to plan for the next few years. It's a long haul. Diba? May 2021, which is survival, containment, 2022, getting rid of it, and then 23, security. So we have that time to now plan out how we will deal with our human health resources. And one of them, because you're the one who pointed out just now that we were all witness to the fact that sa harap-harapan natin, kinukuha yung mga health practitioners natin, di ba? Harap-harapan, they were dangling good pay that we can never even begin to match. So what do? So we have to come up with a scenario where we can benefit from it. And this is at no cost to our graduates. Walang gasto sa kanila yan. This is the countries in demand who now, and this is where I'd like to share a little bit of my experience. I was the president at some point of the women's sector of the Interparliamentary Union, and I chaired a session with the parliamentarians of the European Union, and the issue was migrant women. And all of the members there were very proudly saying how they take care of their migrant women, the migrant workers, which includes Filipino migrant workers. Ang galing namin, pagdating nila dito, we take care of them, blah, blah, blah. So I was sharing that, and at the end, I just made a comment, well, I'm glad that you're taking care of them because they're taking care of your family, and meanwhile, they left behind their families. And they also left behind their country that is also in dire need of their services. And we respect those decisions they made, but you also have to be aware na ganito yung situation. And honestly, well, they acted like they were shocked, no? Na parang, kasi I showed them pictures of families left behind, hospitals and medical centers that had no nurses. And I guess they don't think of those things, no? Nagpapasalamat lang sila na nakarating sa kanila yung human healthcare, but they don't know na ganito. They don't know or they refuse to see na ganitong nangyari sa atin. So my point, Mr. Secretary, and to DOH, is that we must do something about it now, di ba? For the continuity of our health human resource supply. So I took advantage of your being here, Secretary, because I admire your vision, I admire your ability to see the whole picture, and I hope that we can really work on that because we will not be able to solve this problem. That's why I gave you the numbers that came from the Professional Health Alliance group, that we will never achieve those number of nurses that we reply. They did the numbers, I'll send it to your office. But I feel we can if we approach it creatively. So, on that note, I don't know, do you want to make a quick response to that, Secretary? Because then I'll move on.
Yes, ma'am. I believe the challenge that we have right now, Your Honors, is that on how to really supply that conflicting demand, the conflicting demand of our health workers to be deployed abroad, and also the demand of our hospitals for nurses and doctors. So with that, we have to create a lot of UPPGH. Meaning, we have a satellite campuses for the UPPGH in other areas. Like for example, we create a lot of schools. Like for example, we have a very that the UST produces a lot of medical professionals. We have also to have that kind of vision that we have to really move so that we can develop our human resource by recruiting possible medical professionals. And by doing that, we can only do that if they saw that they have a place in the future in our healthcare system, both on the national government and also in the private sector professions.
Yes, thank you for mentioning UP, because actually in our hearing, they also told us that their School of Health Sciences is really devoted to producing the health human resource that's needed. So they'll also be presenting that in the separate hearing that we have, similar to what you're pointing out, Secretary. I'd also like to bring up, since I have all of you here, including, of course, Yusek Vergere, my personal ideas on improving our health human resource, which is how come up to now we do not have practitioners similar to the nurse practitioners and the doctor's assistants that they have in the US, because those are the professionals that they're able to deploy in far-flung areas where they also similar to us, and as I pointed out, they are already a developed country, and yet they make use of those professionals to be able to reach far-flung areas. So if I'm not mistaken, that is a 4-year course, but it's very specific so that they can handle certain cases that an average nurse, a regular nurse, cannot handle, because they are trained in a different way. So I'll take that up in the health human resource, but I just wanted to point out to everyone present that these are all the angles that we're looking at to be able to achieve our goals of providing our people with the health services that they need. So no need for a reaction at this point, but I'm just parking it there for everyone's information. The next speaker would be, I just want to get a time check from Secretary and Yusek. You can still stay with us because our colleagues might have some questions. Are you still okay to stay, Secretary Charlie and Yusek Vergere? Okay pa naman kayo to stay?
Ma'am, I can stay until 5 months.
Until 5. Okay, sige. So anyway, the WHO will just have a short presentation as well. And then after that, we'll open it to the questions of our colleagues. And then my staff is taking note of the other groups that would also like to speak. So let me now call on Dr. Rabindra Abeyasinghe. Please, sir, from WHO, you have the floor. May I ask Senator Riza to chair while I'm just take a bathroom break so that we can proceed. Thank you.
Will do, Madam Chair. Sige
Thank
po.
you. Dr. Rabindra, please, you may proceed.
Thank you, Senator Pia Cayetano and Senator Bongo and Senator Monteveros.
Thank you, sir.
Thank you for this opportunity. Also, Secretary Galvez and Secretary Vince Dison, I believe, are here, and also Yusek Vergere and colleagues from other departments. Thank you for the opportunity, and thank you for inviting WHO to these important deliberations of the Senate Committee on Health and Demography. I would like to start by complimenting the government of the Philippines on its effort to strengthen its capacity to respond to health emergencies, and the series of measures that are being discussed today, namely the establishment of a Philippine Center for Disease Prevention and Control, the Medical Reserve Corps, and the National Health Securities Bills, are all very much in line with measures that WHO has been advocating, aligned to strengthening universal access to healthcare, aligned to the Asia-Pacific strategy for emerging infectious diseases in the region, and also minimizing the potential harm to the health of populations as we aim to achieve the Sustainable Development Goals for health. So let me start by thanking the Honorable Senators and our colleagues from the IATF and the Department of Health for their efforts to identify and strengthen these important pieces of legislation which potentially would help to make a difference in the government and the national response capacities. I also want to acknowledge the DOH for its efforts to strengthen its response capacities by addressing the report of the joint external evaluation of the IHR capacities in the countries. We view this as a fundamentally important measure to build capacity in the country, and the fact that some of these bills will actually help address those recommendations are commendable. And the fact that these measures are being addressed while responding to the COVID-19 pandemic is commendable. And we salute our colleagues in the Department of Health for being proactive in these efforts. I would like to address a few of the components that are mentioned here. And if I may, with your permission, I will start with the Philippine CDC Act. The establishment of the Philippine CDC, we believe, will be an important step in enhancing the preparedness and response capacities of the national government. During the early stages, we actually proposed, because we've seen that the very good recommendations that were coming out of the Department of Health sometimes were not implemented with the kind of speed necessary to respond to the pandemic because of the localization at the different devolved units of the local government system. So the provisions within the Act which provide for streamlining that coordination during public health emergencies, we believe, is a step in the right direction, which will help enhance the coordinated response capacities throughout the country and will make that response far more effective. In addition to that, we would like to propose, in addition to all the measures that were proposed by Secretary Vergere and Secretary Galvez, to explore possible inclusion of provisions to include the DOH-linked specialized infectious disease hospitals that are to be established in each of the regions, to be identified as centers of excellence, and also to be used as training facilities to train clinicians in the management of specific diseases, to improve disease management outcomes under the auspices of the Philippine CDC. Following the establishment of the Philippine CDC, this would help broad-base the expertise and make it available across the regions and provinces of the country. Additionally, we would also like to propose that the Philippine CDC Act, I believe, already includes provisions for linking with the Bureau of Quarantine, while noting the relatively good performance of the points of entry managed by the Bureau of Quarantine during the joint external evaluation. We believe that there is still room for enhancing those procedures so that we can, as we have seen during this pandemic, the need for management of the potential introduction of pathogens and people at risk of introducing such pathogens. So if there is provision to include a better coordination and streamlining of actions so that the points of entry capacities are strengthened, but also capacities for managing migrant health issues, particularly because of the large movement of migrant populations, particularly in the southern parts of the country. If these aspects could be included in this, we believe that it will significantly strengthen both the points of entry and the border control, which is critical to managing the public health emergencies and potential pandemics of the future. We will also like to propose that the government considers strengthening the public health laboratory network under the auspices of the Research Institute for Tropical Medicine. So there has been significant investments into expanding laboratory capacities as a response to the COVID-19 pandemic. And WHO views it critical that these investments are channeled into a sustainable strengthening of the healthcare system through the establishment of a public health laboratory network that is very closely linked with the proposed Philippine CDC, and thereby its sustainability and management capacities improved and strengthened. So these are some of the things that we wanted to propose under the Philippine CDC Act. The proposal for the medical reserve crops is also a very important measure, as we have seen. The act per se is a positive measure in the right direction. We would like to propose that this could be further strengthened by consideration of including, if not already included, and integrated into that a possible linkage with medical and nursing schools and other allied health disciplines, meaning medical technologists and radiologists and other areas which may be relevant, so that the medical reserve crops could be have more access to human resources, and also will facilitate the identification and training of potential candidates who could be members of the corps. In addition to that, we would like to highlight that while the medical research corps per se would be a voluntary exercise, it may require a center for the management of this endeavor. And so what we are proposing is that adequate funding be identified for the establishment of and management of medical research crops that will be able to be mobilized at short notice, and which will have the capacities that will be expected of it to actually boost national response capacities. And finally, we would like to propose that the National Health Securities Bill, of course, as Yusek Wegeri pointed out, it comes directly out of the recommendations of the Joint External Evaluation, and so this is we are fully supportive of all of these three bills. What we would like to propose on the broader scale is to explore a link to these three bills being linked to the current efforts and future efforts ongoing to strengthen health systems and universal health care and building resilient health systems. With this in mind, we would particularly like to, and this is something that you were already discussing, is the health for human resources. So integrating training on emergency response as part of medical and public health training, and having an adaptable existing workforce that is already trained in these key aspects will help address deficiencies in health human resources, particularly in the underserved areas of the country. We would also like to focus on the fact that there will be a need to focus on disease control and health service delivery, especially adapting in the event of crisis to having prioritized services, triaging of patients, referral systems, and of course building on the one hospital command system that has been established, improving its functionality and its capacities so that better access and services can be provided to the population. An additional area that we would like to focus on is on the medical commodities. If you may remember, in the early part of the pandemic, there was significant challenges in accessing critical supplies and personal protective equipments, and we faced significant supply chain and logistical challenges, some of which we continue to face now. We know the challenges faced in accessing oxygen therapies at a global level now. So we would strongly advocate for provisions to be made to integrate surge into medical supply chain and logistics systems under these provisions so that the potential for such situations could be minimized in future as we discuss these provisions. And of course, finally, we would like to reiterate that all elements of universal healthcare, namely quality, efficiency, equity, accountability, sustainability, are factored in as we work towards operationalizing these bills. I would like to thank you for providing me this opportunity to provide these comments. Thank you so much.
Thank you so much also, Dr. Abeyasinghe. The committee, led by its chair in this hearing, Senator Pia, appreciate your presence here because as both you and earlier Yusek Vergere pointed out, the results of your joint external evaluation with the Department of Health in 2018 are either the inspiration for or directly related to all of the bills we are considering today. And thank you also for, again, always reminding us that all of these are in the context of the implementation of universal health care and its various pillars. And finally, thank you that WHO is accompanying our country as led by the DOH and the IATF through this terrible but indeed survivable pandemic. Thank you very much, Doctor. At this point, I'd like to turn the chairing over back to Senator Pia. Madam Chair.
Thank you, Senator Riza, for that. I actually caught most of what our distinguished guests relate to us. So thank you also for that, Dr. Rabinda. May I now acknowledge the presence of one of the authors of our bill and of course our champion behind the Red Cross, Senator Dick Gordon. He's here. He was here, but if he can hear me, if he would like to say a few words as one of the authors of the bill. If not, I will proceed. Anyway, if Senator Gordon's staff is there, just let him know that we can, if you would like to say something, just bring it to my attention because we will proceed now. So those are the key resource persons we have. I'd like to open the floor to questions. Senator Riza, I'm not sure if Senator Marcos is still here. But Senator Riza, you can go ahead and proceed. Do you have any questions at this point?
Thank you, Madam Chair. Actually, I don't have any questions. One of those rare hearings that our resource persons have so satisfactorily shed more light on the bills we're considering. So,
Yes.
so Madam Chair, I'll just look forward. I'll just look forward to any technical working group or whatever further process that Madam Chair will instruct. So, thank you, Madam Chair.
Yeah, I actually have the same reaction to you. I was going to say that the presentations of our resource persons were very on point. I took note of some of the details, and some of the details actually need not even be contained in the bill. I will not wrap up yet, but papunta to doon na what we will then have to do is go into a TWG to really thresh it out and to see how to finalize the bills. To address one of Yusek Vergere's points earlier on on the important work that they have already done in connection with the international health regulations, the process that they have already been through. We have no intention of reinventing the wheel. Don't worry. Hindi ko type yan. Hindi ako ganyan. In fact, I like to listen to the experts. And so there are references to my bill, and I believe Senator Riz's bill on the IHR, tama? IHR. And we will leave it at that. No, you tell us what you'd like to add, because it's a bit technical when it comes to that. So don't worry, we would like to follow your lead on that. And then there was also earlier comments from DOH on the question raised was whether the medical reserve would be compulsory or voluntary. My bill is voluntary. I do believe most of the bills are voluntary. I'm asking my staff to double check, but my recollection, it's meant to be voluntary. So the challenge we have now, and all of your collective, I also challenge the medical associations that are present here. Maybe WHO can help us. My challenge to all of us is this: how now can you provide benefits to these volunteers so that it becomes attractive to them? I recall, Secretary Galvez gave a little bit of background on the histories, no. So ako naman, yung recollection ko with the Peace Corps, I recall that their history lies in that time of activism, no. Ano ba, 60s ba yan na, I might even be wrong with the dates, no, but they wanted to encourage the youth, no, to go beyond the borders and help. Kaya daw nabuhay ang Peace Corps. So it was really that, no, that idea na you can combine adventure and helping your fellow human beings all over the world by joining the Peace Corps. So something like that naman yung the question now is, and this is maybe where we can bring in behavioral scientists, sociologists, marketing people, to help us formulate what would make it exciting to join, to be a medical reservist, right? Because nga hindi naman natin kayang i-compensate yan na napakataas, although of course when they are called to duty, they should be compensated. But meanwhile, as they are enlisted, they go through that minimal amount of training. Ano ba yung pampa-entice natin sa kanila? Offhand, yung mga naisip ko, I take this also from a US model. Many years ago, when my friends were migrating, my classmates were migrating to the US, and I checked in with one of them, and sinabi niya na finally, nakakuha na siya ng government job in the US. It's a lower paying job, but the benefits are worth it. Not just the retirement, but their health benefits, it's worth it. So something like that, di ba? Ano ba yung mabibigay mo dito sa mga medical reservists, or for that matter, health workers in government, that make it worth it for them to make those sacrifices? I appreciate that one of the was it Secretary Charlie, somebody, or maybe it was Yusek Vergere, I'm sorry, I can't recall which one of you, gave the example na yung magandang setup sa CDC sana would be that the experts that we will bring in would still be able to practice outside. And for me, it should be a no-brainer, because that's how they continue to be experts, diba? They still have interaction with their patients, they can still do their papers, and yet they're already part of a pool that is mandated, that is committed to serve, no, under whatever mandate CDC has for them. So yan ang gusto ko rin, moving forward to improving the human health resource in the provinces. They have to have wag naman a survivable salary, diba? But ideally, why not? A lucrative career, diba? A fulfilling and lucrative career. So how do we make it? How do we model that? And I know, obviously, because of syntax and also PhilHealth, in the laws that we passed in the last 10 years, I've already seen the difference, because a lot of doctors can now earn extra income legitimately through the proceeds of PhilHealth because services are now available to a bigger group of people, a sector that otherwise would not have been able to pay on their own. But because PhilHealth is paying, then the doctor's fee is also increased because they get payment from PhilHealth, which brings us to the problem of PhilHealth. Hindi naman nakakabayad. But that's a whole other problem that we have to deal with. So I will have to have another hearing altogether on the human health resource kasi medyo iba yun na we have to focus on that. Those are my very quick reactions lang. May I ask my team, has there been any other group that would just like to make a comment, reservation, whatever? If you all recall, I noted early on that there were some reservations on the need for a medical reserve corps, but I spoke about it. I mentioned I put on record my response to that of course I am open. If it turns out that there are other ways to handle this, I am always open. But I think I addressed the main concern, which is wag pabayaan yung basic healthcare. And I think that's a given. In fact, both Yusek Vergere and Yusek Charlie Secretary Charlie have confirmed what I said, that hindi basta-basta madaling mag-pull out ng mga tao to deploy somewhere else in our current structure, which supports the need for a medical reserve. There was also a comment, I think it was from DOH, that perhaps we can use the existing structure of NDRRMC. I personally have my reservations. By law, the NDRRMC law does include health response, but maybe Secretary Charlie, you can respond to this more specifically. Ang iniisip ko kasi is NDRRMC would be trained for natural disasters, which occur so often in our country. So if we really want a response team that is attuned with those kind of emergencies, then their training is specific to those kind of emergencies. To me, in my humble understanding of this pandemic, it's so different. So in as much as there could be an overlap, I do believe that there has to be a really specific team, and that would be the Medical Reserve Corps that has that training and capability of responding. So would you have had a chance to think of this, Secretary Charlie, yung bang kaya bang i-absorb yan sa NDRRMC? And one more point raised, so that isang sagutan na lang, was also that this be an AFP-led endeavor. Just to point out, in my bill, the wording specifically is the AFP may be enlisted by the Secretary of Health to provide expertise on the organization and paramilitary structure. So in my bill, there is already a recognition na expertise talaga yan ng AFP. So yun, may I get a comment, Secretary Charlie, please?
Ma'am, we can, your Madam Chair, Your Honors, we can have some sort of hybrid organization wherein the armed forces and the other services will recruit more or less 10% of the recruitment will include medical professionals. Meaning these medical professionals will be enlisted to the armed forces. And if you have an armed forces of 140,000, we immediately have 14,000 reserve that can be deployed anywhere. So that's one point. And we will also have that kind of organization with the Philippine Coast Guard, Bureau of Fires, and also Philippine National Police. If you will have that kind of organization, it's already intact within the organization. And with that, we can say that they are our Medical Reserve Corps, which is very active in the services. If you can see in the start of the pandemic, we have the Philippine Coast Guard who helped the PRC in the testing and also in guarding the post in our airports, and also being used to help also the BOQ in guarding our COVID patients. And with this, madam, we can increase our capacity to deploy any people we can deploy the armed services to any areas that been affected by any disaster. If you can see in the different countries and even during the Ebola, during the time that there is an extreme magnitude of emergencies, it is the uniformed services that take over, or maybe they will be deployed more, so that we will not have any problem in terms of their additional cost, in terms of, because they are already enlisted with the armed forces. But we can term them as a medical reserve corps in the armed forces, because they will be deployed as a medical professionals during the time of the pandemic. Second, we can have what we call an accredited organization as a reserve component. For example, Red Cross is naturally a medical healthcare provider, and by virtue of their mandate, they can be tapped as a medical reserve organization. And by doing that, we can task them in a separate functions. Like, for example, right now the PRC is multi-task in providing tents, in providing testing, and also providing vaccination centers in this pandemic. So with that, we can have some sort of some sort of a law. For example, the National Health Security Act will provide that the armed forces, it is mandatory for them to recruit at least 10% of the recruit will be medical professionals. We have already that vision. For example, for IDPs, we have required the armed forces to enlist at least 5% of the IDPs. And I believe with this, we can also have a policy to be given by the Congress that the armed forces and the different services should recruit at least 5% of their quota in the recruitment. So that in the long term, when we recruited more or less 2,000 every year, in due time we will have more than 20,000 reserves that we can deploy anywhere. Meaning we cannot have any more excuses that we are not prepared, because we have the armed forces and the services that can provide more or less 20,000 or 30,000 fresh legs that can be deployed anywhere.
Thank you for that, Secretary. Your response reminds me of this input I want to share. I'm actually the regional chair of the Unite Network of Parliamentarians committed to end infectious diseases. So I represent the Asia Pacific region. And in the early days of the pandemic, I had asked our chair, who is an infectious disease expert plus a member of parliament, Dr. Ricardo Late, about what kind of legislative response would be good to consider. And one of the recommendations was, in fact, a CDC and a medical reserve. And at that point, we had more lengthy discussions, and I learned, I did not know this before, that the CDC is modeled after the armed forces structure. No, because apparently, and even with the medical reserves, it was explained to me that the whole objective here is a quick response, and it is really the armed forces that have the training embedded in them to react that way. And that's how I came to understand the importance of the cooperation with the armed forces. Because prior to that, I have to be honest, it would not have been my inclination to consider it as a structure that included, or not maybe included, but honestly, it wasn't top of mind on my end to think of it as an armed forces response or a primary duty. And I was educated by learning that it is really their training. So it is a practice worldwide. And I'd like to get a very quick response if WHO Dr. Abaya Singh, who is still with us, to confirm that, because that is my understanding. But if he has anything to add on that, is he still here with us? If not, and while we wait, I know that I can see Senator Gordon is with us now, and I'd like to give him the floor if he'd like to say a few things. He is the author of one of our measures, and of course, he is the chair of the Red Cross. Senator Gordon, would you like to say a few words? The staff of Senator Gordon, can you let him know? Hi, would you like to say anything, Tito Dick?
Thank you very much, Pia. I was just listening to the conversation. I'm having 3 meetings at the same time. If you'll pardon me, I'm with the Red Cross right now, and we're meeting about the vaccination system. And I just called Dr. Pilando about the examination of 28,000 nurses, which mercifully the IATF, thanks to Charlie and Vince, have already recommended what I wrote, that they should be allowed to do their examination earlier than the November that was intended to be that they intended to do. Now, I also got confirmation that it's already going to be regional, because really that's a big problem right now, to get our nurses and our doctors on the ground as much as possible so we can really start fighting the problem. Now, I have just 2 points. Thank you very much, Senator Pia, for your kindness. One point is on the matter of the CDC. I think I overheard Dr. Vergeri saying that they will be under the Department of Health. I most vigorously oppose that. I think that the reason why you have a Center for Disease Control is that you will want to be able to get doctors who are independent-minded, not to tiptoe their way into a political minefield. I hope you're understanding me, because there's a lot of minefield that the Department of Health has to go through, and that is why the DOH has been hard put to really come in. And I sympathize with the people at Department of Health, because there are always minefields floating around, and certainly not even for most politicians. I hope not including us. There are certain demands that are made upon them that sometimes may not be the best interest of our country. So my position is, I think the CDC should be independent, subject to certain controls by the president or by an advisory board. The other point I would like to make is we already passed the Doctors para sa Barrio, para sa bayan. And you will recall, I think that I overheard Secretary Charlie saying that they could either be recruited by the military as if drafted, or to my mind, they could be mandated to serve, but not necessarily in the army, or they can volunteer. So far as I'm concerned, in a pandemic like this, the government must be free, especially for the doctors para sa bayan, to really get all these doctors and nurses to work, because we're against time, and we really need to do this. It's just like war. For that matter, I'm even favoring the idea that in the military, they what you call corpsmen or medics, no? And the medics are not full-blown doctors. They're not even half-blown doctors. They're just trained to patch up wounds, apply morphine, dress wounds, and then in preparation to bringing them from the front line back to the emergency field hospital somewhere down the line, and down not in the front. So I think that is something that we have to address right away, that we should be able to generate folks, even high school and college graduates, and we can form medical paramedic corps. Or paramedic is kind of strong because they have to have a lot of training, and there's nothing wrong with that. But even in our ambulances, many of my volunteers are not totally, they're trained for medical emergencies, but they have not yet acquired what we call the emergency medical medical capability that they will apply, and we're trying to adapt that. That's why I have a beast of a doctor that I just acquired, who is been trained in Israel. His name is Dr. Herbosa. Our university dropped him. I think that was a mistake. we should keep our best man. So we're getting him so we can actually use him for the Red Cross and train everybody, upgrade our 170 medical ambulances, and so that it is not just a meat wagon but a life extender. Going back to the original point, I would like to say that any of the three should be welcome depending on the situation. They want to volunteer, they will always be welcome. If they have to be mandated because the pandemic is getting out of control, that's fine. But if there is a war or a very, very serious pandemic that's going on, then they will be conscripted, literally, to get into the military, and they will be part of our system, and the military can send them to private, public, or frontline activity, so that better to have something that you can use rather than to have nothing when you need it. Those are just the points that I would like to emphasize. Again, I don't think the CDC should be under the Department of Health. You can see even the Department of Health that I've tried so much, as you know, tried to say that we ain't done so bad and that could be even be criticized. Although we could have done better. But anybody can say that. I always say that, raise the bar, if you will. But as far as I'm concerned, walang magaling dito sa pandemic. Kung Amerikano, daan-daan libo namatay. Sa atin, 17,000 pa. Tayo naman, yung mga doktor natin, nagkakamatay na, nagkakasugat-sugat na sila. Dapat alalayan rin natin ang Department of Health. At kung imbis na we keep fixing the blame, we all try to have doctors na especially task for that, na hindi masyadong stricto. Halimbawa, I have qualms about the health assessment and technology group na kung minsan masyadong scientifically forcing through. I'm not criticizing. I'm just saying that if we need, let's say, for example, saliva test, and we applied in October, and DOH has already approved it for use in January, then we still haven't gotten the signal from the HTAC. So there are ways, and I think this is a good time to review our systems. The point is, as in business, as in any situation, speed is the name of the game. And you have to get the best and the brightest to really work with the experts and not linger. Because after all, if you delay, people die. If you make a mistake and you're in a hurry, people die. But the essential overriding thing in any organization is accountability. And if you have the best and the brightest there, I will sleep better at night knowing that there are people who are the best in their field, and I would allow them the slack to be able to do what needs to be done. Every day there are people, perhaps doctors make mistakes. They choose the wrong procedure and people die. But as much as possible, it is a function of government to limit the deaths, to make sure that we're able to get the best and the brightest on the ground. And to do that, we have to give the support to those who went into the government and not make them feel that because they're government, they're second-class citizens, that they can be kicked around. Many of the government doctors are quite good, and I believe in them. Many of them spend long hours, and I'm not being a politician here, because I've served as a mayor where we have our own doctors, and I've been to PGH and I've seen what they need. And I think the closer we can bring our doctors to the public with the right equipment, with the right technology, we should be able to do so. Finally, I'd like to say this. In India today, there is just so many people dying because there is no oxygen. You probably read in the papers the Red Cross is now examining the possibility of putting up an oxygen concentrator generator, if you will. I don't know what they really call it. No? It's going to be a hefty amount, but I think it is necessary. And I filed the bill. I hope that you can take it here if you have to, that every government hospital, or for that matter, every major private hospital should have oxygen generation capability. Because high flow, lalo na dito, high flow ang kailangan ng mga tao. Eh kung walang high flow, nauubusan, talagang you can see the graphic images of people in India writhing in pain, shrieking for doctors, begging for assistance. And this really needs what we call predicting and planning and preparing so that we can practice right now and so that when the time comes, we're not short. This is not the time for fixing the blame. This is the time to do a huddle, and it should not be a quick huddle. We should be able every week to talk about it ourselves and see what we're doing short and where we're doing long and what we can do faster and more focused and more flexible. So, ladies and gentlemen, thank you for the time. I appreciate it. Dr. Cayetano, my very dear favorite senator, thank you very much. I hope you don't mind if I came out a little longer than I should. Thank you.
Thank you very much, Senator Gordon. I appreciate your interventions. You filed the bill on CDC. I actually had a draft that was ready to be filed, but when I saw that you already had one, I said I'm not going to bother, finalizing mine, spending hours. I'll work on yours so we can move forward. Your experience on the ground is very well noted, and we'll take your lead on that. So
Yeah,
thank
what
you.
is yours is mine, and what is mine is yours.
So thank you for kindly sharing. So on that note, I am happy that we actually ended this way because this is really meant to be an overview of the interrelated bills. And then from here, I will go into TWG for the details, some of which were already included in the presentation of Yusek Vergere, in Secretary Charlie. And of course, there are some minor, I don't think that major differences in the bills that our colleagues filed. So I also take note, my staff took note of the messages that were posted on the chat box. Feel free to use that anytime. Just to read one of them, Dr. Jeremy Cordero of the Philippine College of Emergency Medicine says that our college will wholeheartedly would like to aid in the medical corps and would like to contribute in the TWG. So thank you. Ganyan talaga ang klase ng support that we are happy to hear. And I know that I join my colleagues in thanking the professional health workers for your dedication. I have no words. I do not have enough words to express our gratitude in what you are doing for our country. The only thing I can do to repay is to really help provide that structure that will make you more efficient with your work, give you a more, given that Secretary Charlie said we're in this for the long haul, set this up so that you can still have a life, you can still have time with your family, safely go home to your families and do the job that you chose to do. So I will suspend just because we might have another hearing, but let's be prepared to go into TWG. So on that note, I'd like to thank the resource person. You've spent a good 2 hours with that. That's a lot of your valuable time. Secretary Charlie, maraming salamat. Si Secretary Vince nag-text sa akin kanina that iwanan niya kayo because he had to go ahead to other important meetings on the vaccines. We're very excited. I'd like to make public na rin yung papasalamat ko na Secretary Charlie and Secretary Vince went to Taguig for the rollout of Gamaleya, and I think he shared many positive news coming our way on the availability of more vaccines in the days to come. So thank you so much for your hard work and negotiation skills on that. This has not been an easy task for anyone, and I'd like to commend you, Secretary Charlie, for your work. Yusek Vergere, it goes for you too and your team. Maraming salamat for constantly being there and paving the way for a more responsive DOH. A lot of the problems we face are not your fault, your team's fault, because these are, as I said, let's admit this is decades of failure to give healthcare the kind of investment that it should have been given over the past decade. So I hope, Secretary Charlie, with your help, mapasa natin to and mapalagyan natin ng pondo itong mga gusto nating magawa in the next few days to come. May I ask the other resource persons to submit your position papers? We will review it so that we also know very specifically kung ano yung concerns nyo, and we can invite you to the appropriate TWG. But you are all welcome to come to all because, as I said, these are all interrelated. So on that note, I will suspend this hearing. Maraming salamat sa inyong lahat. Please stay safe and take care. God bless you all.
Thank you. Maraming salamat po.